Hi class, in this recording we're going to focus on the organs of the urinary system that transport urine. The ureter, urinary bladder, and urethra. So let's dive into it. As we are looking at the urinary system, I'm going to go ahead and scroll up here to the urinary system, and let's just focus on, let's do the female urinary system, fewer structures. So what we're looking at here at the female urinary system, we have kidneys that make the urine. Urine is then going to be transported through the ureters. Let me zoom in here. There we go, the ureters. And those ureters will carry urine all the way down to the urinary bladder, where the urine is then stored until we urinate, or micturate, to use the more technical term. I want to emphasize that the ureters enter the urinary bladder on the posterior, and then urine will leave the urinary bladder on the inferior posterior margin through a tube called the urethra. And that urethra will have some sphincters associated with it. Here is the external urethral sphincter. This is made of skeletal muscle tissue and can voluntarily constrict to help you hold in your urine. And if I pull this back here, if I remove this, we can see how there's a bulging right here. This bulging of the urinary bladder forms the internal urethral sphincter, but this is also going to be made of smooth muscle. It's involuntary, as opposed to the voluntary external urethral sphincter that is made of skeletal muscle tissue. So that's the ureter, urinary bladder, and urethra, in particular the female urethra. Let's focus on parts of the urinary bladder. Now first I want to emphasize we're saying urinary bladder because I don't want you getting this mixed up with the gall bladder. Don't just say bladder, there's more than one bladder in the body. So here's the bladder, and the urinary bladder is effectively one giant mass of smooth muscle. The name of that smooth muscle, come on, let me select it here. There we go. That mass of muscle, now I selected it, is going to be called the Detruster muscle. And if I look at the Detruster muscle, the access points where we have, let's go ahead and just add the entire detrusor, or the entire bladder, and let's see if I can make this happen. I'm going to zoom in and hopefully have an interior view. Awesome, it worked. So here's an interior view of the urinary bladder, and we have the the ureteric orifices. This is where the ureters drain into the urinary bladder. Here's the internal urethral orifice. That's where the urethra carries urine out of the urinary bladder, and they make a triangle. This triangular structure is notably smooth. There are no rugae here, or ridges. We refer to this smooth structure, that smooth triangular structure, as the trigone. As we're looking at the detrusor muscle, I need to point out the histology of the detrusor muscle. It's just smooth muscle fibers. So here is a photomicrograph of a urinary bladder. I hit the space bar again. And this mass of muscular tissue right here along the outer edge, this is the detrusor muscle. This smooth area right here, where there are no rugae, is referred to as the trigone. And then you can see how there's these large folds on this urinary bladder. Those folds are the rugae. If I zoom in here, I want to point out how the urinary bladder is lined with transitional epithelium. If you're crusty like me, you learned it as transitional epithelium. This is an epithelium that can stretch out. Transitional epithelium is only found lining the urinary system. So a new name that's being introduced for this epithelial tissue type is urothelium, to pay homage to the fact that it lines only the urinary system. So right here, we have the transitional epithelium. And I want to emphasize with transitional epithelium, there's a scalloped edge on it when it is relaxed. So I'm zooming in. I have max zoom here. And I want to emphasize this scalloped or bumpy edge of that transitional epithelium or urothelium that lines the urinary bladder. And I apologize for the background noise right now. I'm in a coffee shop because I don't have internet at my house. And holy moly, that espresso is pretty loud. So, those were the sphincters associated with the urinary bladder and the histology of the urinary bladder. Let's talk about differences between the male and female urethra. One of the big differences is length. The female urethra is quite short. It's about 4 centimeters in length. So if I go, let me go ahead and close that out there. And let's zoom out. So this is the female urinary bladder. And that female urethra is quite short. Let me go to the settings here. I'm going to change this from female to male. The male urethra, on the other hand, is much longer. So instead of being about 4 centimeters, it's closer to 16 centimeters in length. And as we're looking at the male urethra, we really can't appreciate it unless I add some more structure. So first, right here, we have the prostatic urethra. This prostatic urethra is going to be the portion of the male urethra that's in the prostate gland. So I'm going to go ahead and add the prostate gland. There's the prostate gland. The prostatic urethra is the portion of the urethra that travels through the prostate gland. Right here, the prostatic urethra. And then we have the membranous urethra. Here's the external urethral sphincter. The membranous urethra is the portion that goes through the external urethral sphincter. Both males, technically females have a membranous urethra because they have an external urethral sphincter, but due to the shortness of the female urethra, we just call it the urethra. The male urethra is broken up into 3 regions: prostatic, membranous, and spongy, also known as penile. As the name implies, the penile urethra is the portion of the urethra that goes through the male penis. Another name for it is the spongy urethra. The reason it's referred to as the spongy urethra is because of the erectile tissue it travels through, the corpus spongiosum. So there's the corpus spongiosum, one portion of the erectile tissue of the penis, and the penile or spongy urethra travels through that structure. We'll talk more about that when we get to the reproductive system. And as we're looking at our penile urethra or spongy urethra, there's the opening at the end. The opening at the end is referred to as the external urethral orifice. Both males and females will have an external urethral orifice. In the male, it's the hole at the apex or point of the penis, the most distal portion of the penis. And in females, let me switch back to female anatomy here. There we go. To find that structure, the external urethral orifice is going to be anterior to the vaginal orifice and be posterior to the clitoris. So as we look at our lab objective sheet, just want to make sure I covered everything here. We are good to go. If you have any questions or comments about these body parts or the histology, please feel free to post them on my class discussion board or to shoot me an email. And as always, happy studies.